Hey everybody, Dr. Rob Silverman here. How are you today? Excited to be sharing some information with you. We're here on Facebook Live, 1 o'clock every weekday. Monday to Friday, we're trying to do 1 to 1:30, even though we're back at work. Today we're just getting preparation, writing articles, not seeing any patients. But every day we want to share with you some different information. If anything coming hopefully out of or moving through phases of this health pandemic and COVID-19, we want to be able to share different health tips. And hopefully now everybody understands that health is wealth. Keeping yourself healthy is a critical element to everybody's overall success. So I'm getting a lot of calls now. People want to reactivate. They want to come in. Gyms are not open yet in New York where we are, but people want to start to exercise. Some people actually, I was fortunate. I exercised almost every day. I have a home gym. Many people just gave up on the gym. They didn't know what to do at home. They want to start up. It's been 2.5 months. They put the pandemic 10 on, and now they want to exercise. And what's happened is they started to exercise. A lot of them have got hurt. So remember, my origins is in chiropractic, and we still treat a lot of musculoskeletal injuries along with that functional nutrition, functional medicine model. Once again, matching mechanical and biochemical together. Having said that, a lot of people got injured. So there were a couple of interesting articles. There was one in the New York Times. There was a couple other in some sports journals. But what's really happened is everyone just got up and went back into it. That's not a really good idea. If you haven't worked out, even for a week, you can't just pick it up at 100%. A lot of these people waited 8, 10, and 12 weeks. There was stress. There's financial stress. There may be some chemical stress. People are sitting too much. They were very sedentary. So when they were sitting, they shut off their glute maximus muscles like I am now, and they also tightened their psoas, giving themselves a lot of propensity towards lower back. Real no-brainer, really needed to utilize and look at that. So let's take a look at an exercise plan again after lockdown. I wrote some notes down from a couple of different articles and what I've seen work with the patients in the office since we've been back at it. Number one, you really want to take it slow to prevent injuries. You can't exercise if you're hurt. So that's always something that I tell people. Everybody wants to do this vast Arnold Schwarzenegger, Michael Phelps workout, and you haven't trained like they did. You're not at that level. So number one, definitely don't go when you get back at it. Don't, if you did an hour and a half before, don't do that again. Fitbit was interesting. What they did was they found out they were tracking activities of American adults, and American adults during the time in the month of March as compared to January, when COVID really started to hit us, was 12% decrease, which is substantial. So we're not moving as much. Again, slow down. Let's try and prevent injuries. Inactivity leads to injuries. You can't go, as they say, from 0 to 60 all that quickly, even with a race car. It still takes some time, but it has to be made to do that. So the suggested pace, I wrote some of these down, 50% of exercise before COVID-19 came. So you want to go at 50%. So if you did 50 push-ups per set, I want you to do 25. Obviously, if you were benching 400 pounds, 200 pounds. If you were running 5 miles, 2.5 miles. But I do also want you to do some basic body weight exercises. Some of the things that I've recommended to my patients that we've seen to work really well, helping them get back up, if you will, and get exercising and moving would be body squats, lunges. So the body squat may be the best exercise you could do, body weight. And that's a thing that people don't understand, body weight. This is your weight. I have 185 pounds of weight. So the things that I can move and do with it, a push-up, it's my weight. A squat, it's my weight. A plank, it's my weight. Any kind of exercise, walking on my hands, which I have trouble with, my body weight. So squats are great. Lunges, lunging forward again. You really, when you emphasize your lower back, you can generate, especially for men, the release of testosterone. Remember, people always break up in body parts. I always say, what are you doing at the gym? And they give me a body part. It shouldn't be a body part. It's all about body movements. But if you think about people going to the gym, legs is 1 day a week, and their upper body, they break up in 3 or 4 days. It doesn't make sense. Legs is half your body. So lunges, squats, great idea to get your muscularity back. Yep.
I have a question from Shannon Pyle. What's the best way to get rid of a gut?
Best way to get rid of a gut, I guess that's that pandemic 10 or pandemic 15. So 1, let's get you exercising. 2, Couple of quick, easy things. I've said them before, but I mean, you guys will love it. No gluten, no processed food, no sugar, no dairy. You take those out. So when patients come in and I give them the free $1,000 consultation, it's free. The first one's free. No gluten, no dairy, no sugar. You're going to lose weight. Get exercising. Do these exercises that I mentioned. Squats, lunges, planks, hip raises, cobra stretch for that mid-thoracic, mid-back area. People are sitting. You do those things. Those are tremendously specific. You will start to lose weight. Then I also recommend some specific supplements to help you. Good probiotic, vitamin D3, and a fish oil. You do those three with the three things in the food, you're going to lose some weight off your gut. You're going to lose some of that adipose tissue.
D'Angelo says, what ratio do you recommend for weight resistance versus cardio?
So I just reiterate that. I'm not sure if I heard you. You were kind of dainty when you said that. Very nice. What ratio of weight resistance to cardio resistance? Really good question. Let me delve into that. One, weight resistance, once again, to reiterate, body weight. You can use weights also. You can use bands. You can use a TRX. Bands, TRX, dumbbells, kettlebells, whatever you do, whatever you handle well, whatever you move with good form. And cardio, what we're talking about cardio is, are we talking about steady state or are we talking about high intense interval training? So I'm a big proponent that I like to weight train on one day with flexibility and a proper warm up, and I like to do cardio in another. So at my age, I believe in a good 50-50 split, but within that split, it's what do you want to do? Are you moving the weight quick? Are you bodybuilding, which is great, but that's not necessarily health promoting? Are you lifting weights to hold on muscle mass so you don't get what we call muscle loss or sarcopenia, which incidentally is the first sign of aging? So I believe in a 50-50, but as I was talking to my business partner today, who's a number guy, I said, the devil's always in the details. It's those details after that. But I love the question, and a 50-50 split is a great idea. Some people don't have that amount of time. They don't have the time to work out, 6 days a week, so 3 weight training and 3 cardio. So again, a good 50-50 split would be a great choice.
D'Angelo, again, he just mentioned HIIT.
HIIT. I'm sorry about the HIIT, HIIT, high interval intense training. So HIIT is, we call something called Tabata, which is 20 seconds of exercise, 10 seconds of rest, 8 rounds. High intense interval training. Kind of like I sprint to my elevator back and forth. That's HIIT, as opposed to steady state walking at a very steady state. Trying to really get our heart rate up. It's been found to be much more effective, so you can spend less time trying to burn fat, less time trying to affect your heart, just with more intensity. Great. So the Cobra stretch. Again, most of us are sitting. For weight training, 50% of the volume and 50% of the intensity. Do that for 2 weeks. The next week, week 3, go to 75% of weight training intensity. If you're feeling good, God bless you, maybe you go to 100, but if not, do 2 weeks at 75. In 1 month, I got you back at 100%.
Isaac Lewis says, how many HIIT workouts should I incorporate into my week on top of body weight training?
So how many HIIT workouts should he incorporate on top of his weight training program?
Yeah.
Okay, so I don't know how many times a week you're lifting, so I'll just say you're lifting 3 or 4 times a week. If you want to respond, Steph will read the question. We're using the phone today. The laptop was not working well yesterday, so we went with the phone, so I can't see the questions. So I'm a big proponent. I'll be honest with you, when I travel, my workouts are very different. And certainly I'm going to be traveling in a couple of weeks. I'm probably not going to use the gyms. I'll probably use my hotel room. So high interval intense training, you know, the Tabata that we talked about, which is 4 minutes, that's ample. In addition to that, I do something called man makers. I'm not going to do them. I don't have the equipment in here, but guys, look that up. Those are great. So I think 2 to 3 HIIT.
He answered, sorry. He says usually 4.
4 days of weights. Hey, I got it right. So 4 days of weights, I would do 2 to 4 times of HIIT training. I think HIIT training is great. And I got to tell you something. If you want to pre-exhaust to see where you're at, do the HIIT first. Even Tabata in planks will be pretty interesting. If you've never done it, 20 seconds on, 10 seconds off. And the reason I call it Tabata was that it was invented by a Japanese, and that's his name. Great idea. There's a multitude of high interval intense training. You can do it on a treadmill. You can go up and down, up and down. So what you're trying to do is you're trying to raise your heart rate, rest, raise your heart rate and rest. Great way to get into shape. if you're going to do that and you haven't been to the doctor, please let the doctor say it's okay. Cardiovascular. We do a pulse oximetry here. Just took mine. Stephanie was 100 and I was a little under 199. I'm only about 30 years older than her. So we're doing okay. So high intense interval training. Of course, my wife's perfect. We good with the questions? Great. Keep rounding those questions off. We love it. There's no real studies on the decrease of physical performance with COVID-19. We just don't know. We just haven't had enough time. However, there were studies with those who had the SARS-CoV-1 or SARS-CoV, if you will, and they did a 2-year analysis after SARS-CoV. 52% had a reduced lung diffuse capacity, also a decreased exercise capacity and a decreased health status. So we don't know about SARS-CoV-2, but SARS-CoV-1 posed an issue for exercise after. What do you got?
Maybe just commented, I can't do as much HIIT now that I'm older.
That's okay. You do more than anybody else your age, and you beat most people that are considerably younger than you. That's why you look so pristine. So how am I doing, Steph?
Great.
That's great. Showing a little charm today, guys. We're having a little fun here. Exercise boosts the immune system, and that's huge. I try and tell people why I want to exercise. I want to exercise for weight loss. You want to exercise for immune system. So let me give you the facts, and let's delve into that. Exercise decreases the severity of infections amidst a number of, amongst the amount of days and symptoms days. So essentially, the takeaway here is, if you exercise, you won't have as much episodic sickness and you won't have it for as longer period of time. Regular exercise actually decreased influenza by up to 9%. Exercise boosts your immune system. Now, the problem is when we talk about exercise, it's the moderate exerciser, probably me. It's the guy who, I go for a walk 2 to 3 times a week. Not that that's bad. Probably doesn't get the bang for his buck for the immune system. Sometimes the gentleman who's like, I'm a triathlete. I'm working out 2, 3, 4, 5, 6 hours. That's a little too much. So, and that may compromise your immune system. When you exercise intensely for over 2 hours, it's shown to decrease, or if you will, increase your intestinal permeability and damage what we call your tight junctions. In addition to that, it's this horseshoe curve. So, okay, here's your immune system going up. I got a little exercise. I come up here and I got, 45 minutes to an hour. That's great. I'm imbuing my body with a lot of immune cell health. Oh, wait, well, now I'm at 90. Now I'm at 2 hours. Now I'm at 3 hours. And what does that say? Many pro athletes really need to take better care of themselves. And many pro athletes need to supplement, diet, and do all the rehab they do, i.e. LeBron James, to have this really strong immune system. We always think that people who exercise a lot don't need immune help, but they do. The difference probably with someone who's exercising a lot and those who aren't exercising or exercising little is the body composition and the visceral fat. But the best, what they said, believe it or not, is someone like me who's that moderate exerciser who works out, breaks a sweat, but is not drenched in it for a long period of time. No, we're good? So, wanted to talk a little something, post-COVID. Let's get exercising. Let's get moving. Let's get back to health. It's the summertime. We have the outside. Health is our wealth. It's very interesting when you break the things down. Please, when you search out somebody to help you with exercise, make sure they understand exercise. They understand where you are. So one of the biggest things, if I can turn it to me, is, they say, hey, you look pretty fit. Let's do this. Well, I'm 54 and a half years old. I am not going to recover like a 24-year-old. Please take that into consideration. So if you put me through the ringer, I need tomorrow off. So you need to have people understand your status, your goals, your gender, and your movement. So if you don't know how to move, and maybe we'll do an upcoming Facebook Live on why movement is so important, you're going to get injured. The whole premise to exercise is not to get injured. The whole premise to exercise is to enjoy the exercise, keep you healthy, wealthy. Health equals wealth. So maybe we'll do one on movement. Guys, if you have any questions, feel free to reach out. Love chatting with you. Like, comment, share. Remember, on YouTube, Instagram, Dr. Robert Silverman, LinkedIn, Dr. Robert Silverman. So we're sharing all these different things. I really appreciate all your time. I appreciate all your support, all your well wishes. Stay healthy. Dr. Rob, always yours in health.